Much indeed. Let's leave our market coverage with the Dow up 62 points this Monday morning, 16,025. Just hit that. Let's get to Obamacare. Congressman Robert Pittenger is with us this morning. He's Republican from North Carolina. Sir, I've been hearing an awful lot from both Republicans and some Democrats about full-scale repeal of Obamacare. It is chaotic. It is a disaster. I'm hearing a lot of voices say, repeal it completely. What do you think the chance of that happening really is, honestly now?
Good morning, Stuart. I think it's real. I think the American people are going to demand it. You know, the Democrats, liberals, progressives, whatever you would call them, have always had a strong proclivity toward major government programs, from the time of FDR to the Great Society that Lyndon Johnson launched to rid our country of poverty. Yet that really hasn't occurred even after $17 trillion in spending. And now we have a coercive plan, much different, one that's mandated and required. And yet the failure of it is so evident. In North Carolina, we have 500,000 people who can't keep their own plan.
I guess it depends on the Democrats. How many of them will actually retreat from President Obama and say, we can't go into an election with this round our necks? I guess that's the number we've got to look for. But I want to bring to your attention one more item here. United Healthcare has dropped thousands, we don't know exactly how many, but thousands of doctors from their Medicare Advantage program. So that means hundreds of thousands of people cannot keep the doctor that they want. This amounts, I believe this amounts to another broken promise, doesn't it?
Yes, sir. Of course, Medicare was required to lose $716 billion to help pay for Obamacare. This is wrong. This is another broken promise and commitment to the American people. We were told that we could keep our plan. We told we could keep our doctor. And now this is beginning to unfold as well. So I think you're going to see an ongoing unraveling of Obamacare, and the American people are going to say, we want something that allows us options and freedom and a patient relationship with a physician that's competitive, that we will be able to have affordable health care and really be able to get the kind of care that we need and we want.
I wonder if I can make a prediction and see if you agree with me. On November the 30th, the Obamacare website is supposed to be fixed, substantially fixed. If it's not, I think that's the point at which more and more Democrats peel away from the president and say, look, we can't do anything with this turkey, repeal it. What do you say?
Well, I totally agree with you. I think as you look at the actuarials, you look at the risk pool that's required, if people cannot easily access it, they're not going to. And that makes this whole financial capability of Obamacare to be non-existent. You know, it's a train wreck, as Max Baucus said. The insurance companies can't sustain it without enormous premium increases. We've already seen 200% to 300% increases in North Carolina already.
Wow, that's huge. And you've got 500,000 people who've been kicked off their plan in North Carolina alone. 500,000? Is that accurate, sir?
Yes, sir, and only 1,600 people have been able to sign up to the plan. That's disastrous.
Yes, sir. Rob Pittenger, Republican, North Carolina. Thank you so much for joining us on a very busy day, sir. We appreciate it.